My name is Dr. Erinn Harris. I am an practicing internal medicine physician here in Tyrone, Georgia. I am your DPC doctor. This is my first blog or video blog. Really decided I wanted to do a video blog just simply because there wasn't a lot of information out when I started my own DPC practice, and I really didn't see a lot of information when I was blogging, and I just really thought it was a really good idea to make information available freely for anyone who's interested in a DPC practice, such as a patient who would like to join a DPC practice, or any physicians, primary care physicians or otherwise, who are interested in changing over to a DPC practice or starting a DPC practice. So I keep saying DPC practice. What is DPC practice, or what is DPC? DPC is direct primary care, and direct primary care is a different model that has been emerging in America, I would say, over the last 5 years. So in the last, I say, 1 to 2 years, it has become more popular. You've seen it grow by leaps and bounds. They say it's up to a 25% growth. And the reason why that is because it's becoming so difficult to take care of patients under the current model. What the direct primary care practices do is they actually contract with the patient instead of an insurance company. Under the current model, what we do is we contract with the insurance company to cover any office visit fees or any fees in the office. So therefore, our patient comes to see us, we submit a claim to the insurance company, and the insurance company pays us. And that way, the insurance company basically becomes our customer because we're being paid by the insurance company, and the patient is kind of off to the side as a person, in a sense, and I hate to say it, in a way to bring money into the practice, but they're not necessarily our customer. With the DPC practice, our customer is once again our patient. So direct primary care is just basically a new way of doing old medicine. That's the way medicine was practiced previously, and now we're looking at that model again as the best way to practice medicine at this time. So in direct primary care, you have a membership base. You have a patients who have memberships in your practice, and it covers most of your office visit fees. We contract that directly with that patient, or the patients become our customer in a sense. And usually some direct primary care practices do things a little differently. Not every direct primary care practice is the same, but for the most part, most direct primary care practices use the office visit memberships, or use the memberships to cover any office visit fees. And so that would include unlimited office visits. At my practice, I have unlimited office visits. Most of my office visits are 30 minutes or more. Sometimes my new office visits are 1 hour. I have next day, same day appointments. That includes access to me by phone, email, text, at any time, even on the weekends. And it also includes labs. Some direct primary care practices do not include labs, but I include most labs, which are affordable. Some labs that are not so affordable, like estrogen levels and testosterone levels, which are a little bit costly. But the cost of that membership also includes labs. It also includes procedures, most of your joint injections, wart removals, trigger point injections, an EKG, and so it will cover most of your procedures. So I do a little bit more inclusive coverage under my membership. So you guys, you may have thought, well, did you just start doing this, or did you decide to do this? Well, I've actually been in practice for approximately 14 years. I graduated from Indiana University Medical School and trained at Emory University here in Atlanta, Georgia. And after 3 years, did the typical thing that a person graduating from residency would do in internal medicine, is usually work in a primary care setting. And I did that in academic medicine for a little while, decided, kind of finding my way, decided to change and practice in hospital medicine, so I became a hospitalist, and then went into primary care. And then I even tried government medicine at the VA for a while, but I could not find the thing that would satisfy me most, which is really establishing a great relationship with my patients. You could do that in the primary care setting. However, it was starting to become difficult because the average time, I was always looking at the clock, the average time that I had to spend with my patients was no more than 15 minutes. I had 15-minute blocks on my appointment books, and I was not spending 15 minutes with my patient. It was probably 7, and I was always looking at the clock because I knew I was always behind. And so I had such a large panel of patients that I really couldn't establish that good relationship with my patients. I thought probably about year 12, after me practicing for about 12 years, I was really sort of realized that I was becoming burnt out. I was in burnout mode. And a lot of physicians that we're starting to see in internal medicine, primary care, family medicine, pediatrics are in burnout mode. And I just thought there has to be a better way. There has to be a better way to practice medicine. So I started looking into the concierge model, simply because I felt like it afforded more time with your patients, and it was more focused on the patient rather than focused on insurance companies. And I really felt like the concierge model was a little bit overpriced, and it still really involved the insurance model. You would still bill the insurance, bill insurance under the concierge model at some points. Well, I started seeing this emerging direct primary care model, and I thought, oh, this is great. It's more affordable. It's reasonable. People can afford it. For people who are self-employed, for people who have high deductibles, it will work really well for this emerging kind of sect of patients that we're seeing, that deductibles are higher and higher, premiums are becoming higher and higher. They say this year premiums are going to increase by 20 to 40%. And so I have to look forward to paying an increase of 20 to 40% for my insurance, along with everyone else, with the advent of Obamacare kind of putting more people into the system in a sense. And so I thought this was a great model for affordability and to give you the access of concierge. So it's kind of like self-pay matched with concierge, and we kind of put it into direct primary care. So again, the direct primary care model, like I said, you see most patients 30-minute office visits. It's a membership model. You have next day, same day appointments. And with my practice, I choose to say, if you don't want to do the membership, you don't want to commit to a monthly membership, you can also pay as you go. So I do include both of those, and you'll see, like I said, some direct primary care models don't do that. Some people do, some people don't. But I do give people that, say if they only come to the doctor once a year, and they don't want to pay, $100 a month, or which is the price of my membership. They don't want to pay $100 a month for the membership, then they can just pay once a year and see me once a year. Just going back to direct primary care, when I started practicing direct primary care, I mean, it was a total just shift change for me. I just couldn't believe that the way I wanted to practice medicine actually existed. And when I actually started seeing patients under this model, and I was able I didn't have to look at my watch, I didn't have to look at my, to make sure that I was staying on time. Prior to me starting this practice, prior to me practicing direct primary care, my patients would sit out in the waiting room for, I know, at least an average of 30 minutes before they would get back to see me. And now my waiting time is less than a minute, sometimes between 5, if I'm kind of prepping for them to come back to see me, then it's no more than 1 to 5 minutes, and my patients could attest to that because they actually put it on my reviews online. So, and the fact that I was able to just reestablish that relationship with them, reconnect with my patients, if there was something going on besides just high blood pressure, why is their blood pressure going up? Why are they so stressed out? I can practice better medicine because I have more time to figure out what was going on with them. A lot of times, when we're practicing traditional medicine or the medicine models that's out there currently, what we call fee for service, we're so determined on getting people through the door. Sometimes we are getting 30 patients seen in a day that we don't have time to think out what's going on. We don't have time to put, X and Y to equal Z. So I think I take better care of the patient because I have more time to spend with them. Now, I don't want to get into legal issues with that, but I think that anytime that you spend more time with the patient, it will have better outcomes. And anytime patients have more access to you, you have better outcomes. So that's another thing. Patients have access to me. If they have a problem and they need to see me, they can call me on the phone. Maybe they don't need to come into the office. Maybe they don't want to take off work. They can call me on the phone and say, Dr. Harris, I'm having some symptoms. What do you think I should do? Should I come in, or can you prescribe something on the phone? Do you need to see me? And they don't have to go through a nurse. They don't have to go through, a receptionist to block that access to me. That access is open, wide open at this time, and it will at all times will be wide open to me, to my patients. So that's the access they have to me. They can email me, they can text, they can call in order to speak to me about any issues that they're having. And in addition to that, I feel like it's kind of taken the pressure off of both the patient and me. There's the atmosphere in my office is a very relaxed atmosphere. In later video blogs, we're going to go through my office and show you my office and kind of show you how everything works in my office and what a typical appointment would be like in the office. So again, this is the first blog. This is the first video blog, and I'm so excited for you guys to kind of take this journey with me. I know there's going to be more to come, and there's just going to be more information. Hopefully I will be able to get a video blog out at least once a month, if not more. So again, look forward to seeing me on YouTube or Facebook, posting videos directly to Facebook or YouTube. And again, I am your DCP doctor. My practice is Harris Internal Medicine. I'm, again, Dr. Erinn Harris, Harris Internal Medicine, and my website is www.harrisinternalmed.com, and my office phone number is 770-954-5010. Again, I practice here in Tyrone, Georgia, which is a suburb of Atlanta, Georgia, right outside of Peachtree City. If you guys ever heard of Peachtree City, Georgia, where everybody drives the golf carts, that's the area where I'm located. Again, I'm so glad to come into your phones, come into your tablets, come into your computers, and so you guys, we can both learn more about DPC together. Again, great to see you. Hope to see you next time.